Very good afternoon to all of you. At the outset, I'd like to thank Dr. Debraj for including me in this course. It's really wonderful to be part of any of the aesthetic course, especially course by Debraj, Milind, Shubhra. So my duty is to speak on fillers, but I would like to request all of you that please keep your mobiles and other photographic devices on a switch off mode, because these are aesthetic patients and even we request AIOs not to upload them. I think it is always better to learn by saying than by documenting, because once you start doing, you'll be knowing more. So I'll be speaking about the different uses of fillers for the facial aging. I'm a consultant to Allergan Medical Institute. We all understand that the patients are the easels and the faces are the canvas. What we do is we try to create beautiful work of art to maximize each individual's natural facial beauty. We just want to maximize what beauty they usually have. But when we talk about the facial features, all of us should remember the magnificent 7 facial features, and this includes the facial shape, the forehead height, the eyebrow shape, the eye size and inter-eye distance, the nose, lips, and the skin clarity. So when we look to the top 5 features, especially the facial shape, the forehead height, the eyebrow, nose, and the lips, these are all amenable to contouring or with shaping with the neuromodulators or contouring with the hyaluronic acid. But the eye size and inter-eye distance and the skin clarity is beyond the domain of injection therapy. So the question always comes to all of us that what should be the preferred facial volume, or what are the preferred facial features? The most important, the single factor that matters time and again on facial beauty is symmetry. But it's very difficult to have an absolutely symmetrical face. What basically as an aesthetic surgeon we want or we believe is the left and the right side of the face should be considered more as a sibling, and the nose and lips should be considered more as twins. So the nose and lips should be very much symmetrical, even if we have some amount of asymmetry on either side of the face. And if you look yourself to the mirror, you will find that all of us have some amount of asymmetry. So when we all started in the beginning, we usually measure the symmetry by dividing the face into 5 parts, where one part is the distance from the medial to the lateral canthus. So this is what we say the face is symmetrized if all the 5 parts are equal. But today, with more advanced technology and with more introduction to the aesthetic assessment, what all of us believe is the divine proportion, where the proportion of 2 adjacent sides is equal to the ratio of the bigger size is to the sum of the 2. That is what called the Phi Ratio. So when we look to all the 5-6 models from the different part of the country, if you try to measure the Phi Ratio, you'll find that the ratio of the smaller to the bigger is equivalent to the ratio of the bigger plus the sum of the smaller and the bigger. So this is known as the golden ratio. So what happens as we age? There's a reversal of youth. When we are young, we all of us have a very pointed chin and we have a very nice triangle. But once we grow old, what happens? The triangle reverses. We have a medialization of the mid face with a broadening of the lower face, and this is the classic triangle of the reversal of age. So today what we believe that the 4 main underlying factors which changes the facial symmetry because of age is the deflation, descent, deterioration, and the disproportion. And today the consensus guidelines mention that for the facial rejuvenation, all of us should have a combination of 2-dimensional technology along with a 3-dimensional approach. So what I always tell my students is that we have to accept change, because change is evolution, and it is only evolution which brings about the revolution. When we all started the filler, we believed in only one technology that is known as a hyaluronic. The hyaluronic technology is where we used to use filler where the concentration of the hyaluronic acid is very high. But today what all of us believe is the Vicross technology, where the company has decreased the concentration of hyaluronic acid with less absorption of water, so that this is basically used for contouring your face, and we want to just enhance the beauty which you normally have. So the different Vicross technology products are the Volbella, which is usually used for the tear trough, which has approximately hyaluronic acid concentration of 15 milligram. The Volift, which has 17.5, and the Voluma, which has approximately 20 milligram. So this volvula, this by the company, they have projected that it stays for a year, the volume for 1.5 years, and the volume of for approximately 2 years. And by multiple research has shown that the Y cross leads to a better tissue integration as compared to a hyalur cross. So Shilpa has shown very nicely the anatomy, but for a filler procedure, you should know the anatomy, especially the anatomy of the facial artery and also the branches of the internal carotid artery. So the external carotid divides into an internal, and the common carotid divides into internal and the external carotid artery. Branches of the internal wing ophthalmic, the anterocerebral and the midcerebral. So the other branches are internal carotid artery, very important for us, are the supraorbital, the supratrochlear, the lacrimal, zygomaticofacial, and the dorsonasal. So these are the main branches of the internal carotid artery. But the most part of the face is supplied by the external carotid artery, where the branches are the ophthalmic, second branch being the auricular, the terminal branches being the superficial temporal. A branch of the superficial temporal goes, which is known as transverse temporal, and then we have the facial artery. If you look here, the facial artery enters the face at the angle of the mandible, takes a very tortuous course along the masseter muscle, then it ends up being the angular artery. So if you look to this picture here, that the anterior part of the masseter, it is a very tortuous course, because here we have all the muscle mastication. To give space to the muscle, the artery is much longer here, but it maintains the tortuosity. So here it gives a superior labial and inferior labial. So this is the part where the artery is very deep. From here it becomes subcutaneous. You should understand this very important. This is very important, because in the injection procedure, your depth of the injection depends where the artery lies. So as it comes towards the nose, it becomes more superficial, just subdermal. Here it becomes the angular artery. And this are the sites where you have a communication between the internal and the external carotid. This is the communication between the dorsonasal, that is the internal and the external, or with the supraorbital, the supratrochlear, and also it can go to the ophthalmic and the central retinal artery. So when we go for the filling procedure, it can be divided into upper face, mid face, and a lower face. The points where you see red, these are very critical areas. The blue are the very safe zone. Why I'm putting red here? Because you have the supraorbital and the supratrochlear nerves. So this is how we do a forehead filling procedure. But for the eyebrow, classically as an advanced indication, you can take up all the three sides. But for the beginners, you stay for the point E, that is the blue point. Even a single injection of approximately 0.1 to 0.2 ml gives a very good correction. This is what, if you look here, there is so much of volume loss, and if you look here, there is much enhancement of the volume. So what I believe, a single injection in the lateral part along with the Botox injection gives a very nice lift and also a very nice volume. For the tear trough, you can see these are all red. The red, this is here you have the infraorbital blood vessels, here you have the angular, and here you have the zygomaticofacial artery. You should know where the orbital septum ends. Many times I see people inject much anteriorly. Ultimately what they inject, they end up injecting into the orbital septum, and whatever swelling, the orbital fat prolapse was there, it enhances. So this is a toughest area, but I'm sure with due course of time, with due experience, all of you will be able to overcome this. So what I was telling you, the point T1, that is the center, and the point T2 is towards the orbital rim. But the point T3 is much below the orbital rim, and that is how we correct the tear trough. The different ways of doing it, initially when we started, this is an old video. We usually do the point T1 and the point T2, but we were very aggressive at that time, and we always used to start with point 3. But now if we go for good mid facelift along with T1 and T2, it gives a very good correction, and also it becomes a very safe correction. So these are the results you can see with so much of the, we call it the valley and the hill, where the fat is the hill, the tear trough is the valley, and you can see much correction improvement following the injection of fillers. This is only filler injection and nothing has been done. This is a very important requirement for the middle age, because as we age, we see there is prominence of the nasolabial fold, and there is a whole face, it droops down. And these are the points that we are given. We usually give the CK1, CK2, and the CK4. These are very safe points. So what I mentioned here, the medially you have the angular artery, and the angular artery is superficial, and you are injecting in the lateral part. So CK1 and CK2 you can go deep to the bone, but CK4 you have a transverse facial artery which is a branch of the superficial temporal, so you should be, which is deep artery, so you should be in the subcutaneous plane. So these are the changes, like this is before injection and this is the after injection. You can see the lift here, and this is sometimes it is not necessary that every point you will go for a 5-point lift or 8-point lift. Even with a 4-point lift it gives a very accurate correction, but the first point should always be chin. That's a very safe point. The second being the gonial angle. The third is the CK4, which is the pre-auricular, and this is the CK1, which is in the zygomatic arch. And this is the same patient, one side this is the after injection of filler, and this is the before injection of filler, you can see here. So these are the some of the patient before and after injection. For nasolabial fold, I already mentioned here the artery is in the subcutaneous plane, so you should be intradermal here, but if you really want to correct here, you should go deep to the bone, you should hit the piriform fossa. So usually the safe is that she is a very VIP, she is the daughter of a big politician there, so to be in the safer side I had touched only the lower points, but sometimes when there's too much of prominence you have to inject into the piriform fossa, as you can see here. So some patients are really very difficult to manage because they are already, the face is very bulky, and another indication, especially with full lift, you get wonderful result, especially for the lip augmentation. So there are different ways you can go for 3-point, 5-point, 8-point lip augmentation, but what I want to insist is the jawline reshaping, where the best is one in the chin, one in the gonial angle, and this is the CK4. If you can inject all these 3 points, even when it's such a heavy face, this is a lady which I injected just 2 months back, and you can see with such a heavy face, you can also go for recontouring of the face. So you can see I have injected her this is your C1, C2, and this is C4. As because she was having a double chin, so I was injecting C4. This is the gonial angle, and this is the CK4, and this is the CK1. So with this I conclude. Thank you very much.